We're going to get started here. This picture that you're seeing is a beautiful view of our campus here, University of Miami. It's about 80 degrees, blue sky here today. So I hope everyone else is enjoying some beautiful weather. I'm really honored to be part of your event today. Let's see. Okay, great. Thank you for that. I'm not very good at checking the chat while I'm talking, so don't hesitate to just shout out. Okay, so I'm honored to be here today and very excited to talk to you about neurologic music therapy. I have quite a bit prepared for us, so if I talk too much at any point, feel free to cut me off, and I will not be offended. I think it would be important for us, well, first of all, what I want to do is establish how many people, by a show of hands on our call today, would consider themselves a musician. Raise hands. Okay. All right. Even if you're not a musician, I think that you will find this presentation to be helpful to you. Just understanding how it is that human beings have certain kinds of responses to music, where those responses come from, and what we can do with those responses in a therapeutic context. What I'd like to do is begin with a little bit of history, because you may or may not know anything about music therapy, and it's helpful to know where it comes from. So let's go back in time. Music therapy grew out of a movement during World War II in which musicians were brought into veterans' hospitals to perform music and boost the morale of the soldiers. And the soldiers not only heard and saw the performances, but they also participated. The soldiers sang in choirs. They learned how to play instruments so that they could participate in dance bands and orchestras, etc. So the musical experience was very much a part of the soldiers' rehabilitation, recovery, and their re-entry to civilian life. However, there was not really any solid evidence at the time to explain how or why the soldiers might be responding to music in certain ways. They just knew that the soldiers seemed to feel better and interact better when the music was available. And so the profession grew out of this social emotional framework, kind of a feel-good framework. There's nothing wrong with that, but it doesn't give you a very strong leg to stand on in terms of science. The profession continued to grow for many decades after. And fast forward until about, I would say, the early 1990s, right? We had a significant paradigm shift in the profession thanks to technological advances like brain imaging and kinematic motion analysis. And what this did was it provided a connection so that we could see how is it that the human brain is active during music in real time, and how is the body moving actively in real time to musical stimulation. And this technology led to new knowledge, which led us in music therapy to two pivotal conclusions. So let's take a look at those two conclusions. First of all, in the early days of brain imaging, researchers were really thinking that maybe they would find this one magical area of the brain where all of our musical activity took place. And that is not at all what they found. What they found instead is that music is very much a whole brain activity. Music involves not just our right brain, right? Because that's what everyone says. That's the myth, that music is a right brain activity. Music involves your right brain and your left brain. It involves very primitive subcortical structures and higher order cortical structures. So brain areas that we use for music are all over the brain, and they're not exclusive to music. Many of the areas of the brain that we use for musical experiences are also used for everyday, what we call functional behaviors that help us to function as human beings. So the same areas of the brain we use for music, we also use for movement, we use for attention, learning, memory, speech, language, emotions, you name it. Music is tapping into all those areas of the brain. Second pivotal conclusion is that by comparing the brains of musicians versus non-musicians, researchers discovered that when you engage actively in learning music, it will change your brain. So if you are a musician or you've studied music in any way, your brain is different than the brain of someone who's never studied music. And those changes are likely to stay with you throughout your life. And what those changes mean is that you have improved processing for auditory information, for motor control, and for emotional information. But if you are not a trained musician, have no fear. You can still engage in music and it will still be helpful and meaningful to you. These groundbreaking conclusions help us to understand how music therapy works, and they have helped our profession shift away from a social science model to a perceptual neuroscience model of how the profession actually works. And this has led us to a whole new paradigm for research and practice of music therapy that we call neurologic music therapy, often abbreviated as NMT. Within NMT, we have a taxonomy of techniques that exist in these 4 domains. We have techniques that can enhance sensory motor functioning or movement of the body. We have techniques for communication, including both speech and language. We have techniques for cognitive functioning, everything from perception to attention to memory to decision making. All of that falls under the cognitive domain. And then, of course, we have techniques to enhance socio-emotional functioning. My hope today is to talk to you about some of the work that we do in each of these domains and give you some examples and some experiential demonstrations so you can experience it for yourself. Okay, what we're going to do is we will start with the sensory motor domain. And again, what we're talking about here is our ability to move our body. And that might be actually walking from point A to B, or maybe we're just stationary, but moving a specific part of the body. Okay. One of the techniques that we commonly use in this area is known as patterned sensory enhancement, or PSE. Within PSE, what we do is we use carefully chosen musical elements to guide movements through space and time. Today, we're going to focus just on rhythm as the musical element that is guiding movement. As you know, rhythm has many components, beginning with a steady beat or pulse. When it comes to PSE, the music that we use must have high pulse clarity or a very strong discernible beat. When beats occur at a certain speed, then we have tempo. When beats are grouped together over time, then we have meter. And this helps us maybe to establish something like a march from a waltz. Okay? When we are listening to and perceiving rhythm, certain areas of the brain are active. At the cortical level, the highest level of the brain, we see activation in various areas of the motor cortex. But we also have activation in several subcortical areas, including structures that are part of the basal ganglia. What we can see here are the caudate nucleus, globus pallidus, thalamus, etc. Those are very important for refining and determining direction and intensity of movement. So let's walk through an example now that might involve an upper extremity movement. Again, a functional movement that we use every day in human life. Whether or not you go to the gym, you might engage in a movement called a bicep curl, right? Where you just curl your arm in. So everyone do this movement with me. Just do a bicep curl. You can do one arm. You can do the other arm. You can do both arms together. This is an important movement. Think about how many times a day you might engage in this movement. You're going to put on a shirt, right? You're going to pick up your backpack. You're going to lift your groceries out of the car. All of that is a bicep curl movement. Now, for someone who has a neurologic disorder or an injury, this movement is not easy. So they're going to benefit from some PSE. Okay, so let's see. Let's practice doing this movement to some music. And one second, I think I need to stop sharing for a moment. And I'm going to pull up my music. And we're going to do that same movement to some music. Give me one second. Oh, you know what? I want to adjust my volume so that it's not too loud. Give me 1 second. Okay. Get the music going. Oh, I'm going to click into advanced computer audio. I'm getting my music ready. Click Everyone's hearing the music? Can you hear it? Bicep curls. Let's do it together.
Grace says, there I like.
Let's try one arm. Bad. Yes. And the other arm. Beautiful. Beautiful. You got it. Thank you for indulging me. Okay. Let's talk about what just happened because, for you, it was very easy to engage in that movement, correct? Right? So let's talk about what happened. First of all, did that piece of music offer us high pulse clarity? Could you find the beat? It was very easy to find the beat and do the movement, right? So in terms of being able to do that movement to the beat, is that something we have to learn or do we do that automatically? Anyone want to take a guess? It is something we do automatically as human beings. Our nervous system is wired to perceive rhythm in certain ways. And what's really important to recognize is that when we hear rhythm, when we hear a steady, discernible beat, whether it's in a piece of music or it's just a metronome, we're actually getting two important pieces of information. We're getting the audible beat, and that tells us when to be here and when to be here. But we're also getting that duration of time between the beats. We're getting that gap of time. And it's that gap of time that's the most important because that tells us how much time do we have to get from here to here so we can adjust our movement timing and our muscle activity to be in the right place at the right time. So when we're moving to rhythm, what happens is the rhythm provides us with a continuous time reference. The rhythm doesn't tell us just when to be here and when to be here, but it tells us where we need to be the whole time. Okay? And in this way, by cueing the entire movement period, rhythm gives us kinematic stability. So our movements are more stable. Another fascinating thing happens when we're doing a movement like this, okay? Typically when we're doing the bicep curl, which is flexion and extension, we have what's called reciprocal muscle activation, right? When we are flexing the arm into the body, we're activating the biceps. The biceps are active, they're bringing the arm into the body. And then when we're extending the arm, the biceps take a break and the triceps become active, right? So we have this reciprocal muscle activation. However, when we do that same movement to rhythm, the muscle activity changes and we get what's called co-contraction. What happens with co-contraction is that there is a period of time during the movement when both muscles are active at the same time. This is important for so many different reasons because that co-contraction will stabilize the movement. It stabilizes the muscles so we can do that movement more smoothly. It gives us motor control, and it tells us that we're actually learning a new movement, okay? Now, nobody on this call needs to learn this movement. You learned it a long time ago. But what we can see, for example, in infants, when they're first learning movement, they have a lot of muscular co-contraction until they really learn the movement, and then they don't need that co-contraction anymore, and they will eventually shift to reciprocal muscle activity. Okay, but that learning can be really important for someone who has a movement disorder or because of injury or disease has lost motor control. So this brings us to the question of who are the individuals that would really benefit from this particular technique of pattern sensory enhancement? Definitely individuals who have neurologic disorders that impact their ability to move. So that would be stroke patients who might have hemiparesis on one side of the body. That might be patients with Parkinson disease who have a lot of alterations and rigidity in their movement. Also, individuals who've had maybe a traumatic brain injury from a car accident or from a fall or from a gunshot wound, right? So that traumatic brain injury, it doesn't damage the muscles of the body, but it damages the parts of the brain that control the movement. And then also individuals with cerebral palsy will benefit from pattern sensory enhancement, which is a disorder that's often detected early in development, so we can help a person learn movements. Now, other populations that benefit from pattern sensory enhancement include those with orthopedic conditions, maybe someone who's broken an arm or broken a leg, or who might be recovering from knee replacement surgery or hip replacement surgery, or someone who has arthritis. All of these populations are excellent candidates from PSE, right? Okay, so we have visited the sensory motor domain. Now we're going to go into the communication domain. And one technique that a neurologic music therapist will often use here is called vocal intonation therapy, or VIT. Now, I want to make an important distinction here. There is another music therapy technique that is called melodic intonation therapy, and it's abbreviated as MIT. That is also an excellent technique, but it is different from VIT. So just want to make that distinction. Okay, let's talk about communication. What's going on here? When we're singing, what happens is that we need to push a lot of air through our entire respiratory tract. And that tract includes 3 subsystems. The first subsystem includes our lungs and our airways. Then we push the air through our laryngeal subsystem, and that includes our vocal cords where we get that vibration. And then finally, we have to push that air through our articulating structures that further shape the sound. So that might be our hard and soft palate, our tongue, our lips, our jaw, etc. Okay, so that's a long way that we have to push all of that air, and we have to really control that airflow when we're singing. When we are speaking, we are pushing air through that same system, and we're using all of the same structures, right? So makes sense that perhaps we could use singing to exercise those structures and those processes to enhance the ability to speak more clearly. One important distinction we need to make: while we're using the same system, we're pushing air through that system, singing is in some ways unique and different from speaking. And this comes back to a particular aspect of our respiratory functioning known as vital capacity. Vital capacity is the total amount of air we have available in our system for breathing and for sound production. Now, when we're just talking to someone, like I'm talking to you, or you might be talking to someone on your cell phone, we're typically using 50 to 60% of our vital capacity when we're talking. When we are singing, we're using upwards of 70 to 80% of our vital capacity. So we're pushing that air a lot harder through this system, and it's requiring us to engage in repeated contractions of our abdominal muscles over an extended period of time. Okay, so definitely singing is a great way to exercise this system that will ultimately allow someone to have better control over their voice so that they can speak clearly, make sure that they are, oh, speaking of that, um, let me adjust my audio setting. Okay. We want to make sure we can speak loudly enough for other people to hear us. And also, that ability to control airflow allows us to modulate the pitch of our voice when we're talking to someone. And alterations in pitch are very important for the emotional aspect of communication, of the difference between making a statement versus asking a question, or saying something in a friendly tone versus an angry tone, right? Okay, so this is vocal intonation therapy. let's try a little exercise together so we can experience this for ourselves. So I'm going to sing a note, and I want you to just sing it with me and pay attention to where you feel the vibration in your throat. Okay, so we're going to sing. You feel that vibration in your throat? Okay. That's your voice box those are your vocal folds vibrating. And that process of just phonating like that, well, that is phonation, right? And we phonate when we sing or when we speak. Okay, now we're going to try that again. We're going to phonate. Keep phonating, but close your lips. Okay, and see what happens in your mechanism. So, ah, okay, you still felt vibration here, but where else did you feel vibration when you closed your lips? Did you feel it in your face and in your head, right? That meant the air was kind of moving around and trapped in those resonating chambers. Okay, so you have resonance. Resonance is important because everyone's head is a little bit different. Your resonating chambers are different sizes and shapes. And that's what gives your voice a really unique sound, a unique timbre. Everyone's voice is different. Okay, so we know how to phonate. We know what resonance is. Now we're going to try this again. We're going to phonate. We're going to close our lips, and then we're going to buzz our lips. So let's try that and see how that feels. So I'll. Okay. When you buzzed your lips, what did you feel? You could still feel your vocal folds vibrating. You can still feel the resonance. But when you buzzed your lips, that forced you to push the air with greater intensity. You should have felt it in your abdominals, right? Okay, that lip trill, the lip buzz, is a very common technique used by professional vocalists. It helps them warm up their vocal folds and it helps them learn how to control that airflow. Okay, so a musician uses lip trills to sing better. A music therapist will use lip trills with a patient to help them develop that muscular strength to control their speaking voice and enhance their communication. We have covered sensory motor. We've covered communication. Oh, let's talk about who might benefit from vocal intonation therapy. I'm just giving you a few examples here. Some patients who are diagnosed with Parkinson's disease will also have a condition known as hypokinetic dysarthria, and it really impacts their ability to speak clearly and to speak with adequate airflow. So this is the perfect technique for them. Other individuals who have chronic obstructive pulmonary disease or COPD, which can be sometimes experienced as like a chronic bronchitis. And if you've ever had bronchitis, it is no fun. And for someone who's living with that every day, it really impacts their ability to communicate clearly. VIT is a great technique for them. And then individuals who are going through any type of pulmonary rehabilitation, perhaps because they've been intubated during a surgery for a long period of time. Maybe they had an extended case of the flu or pneumonia that impacted their pulmonary functioning. People with asthma, people going through treatment for lung cancer, they all need to really strengthen that whole respiratory system so that they can communicate effectively. So VIT, terrific technique for them. Okay, now we're ready to move on. The next bucket we're visiting is cognition. All right. So much we can do in the cognitive area, right? We're going to focus today specifically on attention because attention is the building block for so many of our other cognitive functions. We need attention for memory. We need attention for problem solving, etc. So we're going to start with attention. And one of the techniques that a music therapist will use here is musical attention control training, or MACT. Right? MACT works by activating a specific neural network that is called the salience network. Okay, so let's talk about this. The salience network consists of a collection of both cortical high-level structures and subcortical structures deep within the brain, as you can see identified here. These structures all work together to help us know where to direct our attention, right? So that we can prioritize. We always have um, lots of stimuli competing for our attention, but this network will tell us where to direct our attention so we can take appropriate action. So here's an example. I'm guessing most or all of you on this call you're old enough to drive a car, right? Driving a car. And when you're driving a car, you're paying attention to many different things, right? You're paying attention to how to operate the vehicle. So you've got gas pedal, you've got your brake pedal, maybe you've got a clutch, you've got your steering wheel, you've got your gear shift, all of those things. You've got windshield wipers. Okay, all of that. You're operating the car. You're paying attention to traffic lights, traffic signals, traffic signs. You're paying attention to other vehicles on the road. Maybe you also have your fun music playing in the car. Maybe you have other passengers in the car, you're talking to them. So you are directing your attention to all of these different stimuli. Now, say you're doing all of this, and then a large truck is coming at you at a high rate of speed, and it doesn't show any signs of stopping. Your salience network is going to say, stop paying attention to everything else and pay attention to that truck and getting your car out of the way of that truck. So salience network is really important, and it's important that it is functioning correctly. So MACT, this technique is one of the ways that we can activate and strengthen this network. Okay. Important to also acknowledge with the salience network and attention, as human beings, we have different types of attention. Okay. I want to share some other music with you. Let me stop sharing for a moment. And I'm going to share some other music for you. And I appreciate your patience while I get my music queued up. Okay. Oh, and I will adjust my volume. Whoops. Sorry. New music. You hearing the music? Let's just clap along.
Seeing every night I have, I swear that's true. And present by the
Just clap to the beat.
time. Left here on my own, so it's said, I've got to leave before.
Okay. And you're thinking, oh, that's so simple. If we just hear music and we clap along to it, that's so simple. It's simple for us because we have healthy brains and we can detect the beat and we can coordinate our movement with that. And so to clap along with the beat for the duration of a song, again, it seems simple to us, but it would not be simple for someone who has some type of brain injury or brain disease process that is impacting attention. That ability to clap along with a piece of music for the duration of the music, that's called sustained attention. It's just sustaining our attention over time. Now, when you were listening to the music, you heard different instruments, correct? Yeah. What were some of the instruments that you heard? How many people heard piano? How many people heard drums? Right? So you can hear some distinct instrumental parts. Okay. We're going to listen to that same piece of music. And this time, when you hear piano, I want you to just snap your fingers, but only when you hear piano. Okay? If you're not hearing piano, don't snap your fingers. Okay. So let's try this again. Start over. Okay. So we're going to snap when we hear piano.
See if I've got to have a chance of seeing every night I have spare yesterday. Present by the way, and This is left you on sudden.
I'm going to stop there. Let me come back. Okay, oops. I lost my people. 1 second. Oh, sorry. I lost my screen share. Bear with me. Here we go. Where's my screen? Oh, I want to share from current slide. Beautiful. Okay. Again, when we're clapping along, just clapping to the beat for the duration of a song, that would be sustained attention. But when we're listening for a particular cue and we're only responding when we hear that cue, that means we're utilizing our selective attention, okay? Which means we really have to shine that spotlight of attention on just one thing, and we kind of have to block out everything else. Early in the song, it's very easy to hear the piano. And then as the instrumentation layers, we have to really focus and say, well, am I hearing piano? Is it really there? Do I need to keep snapping, etc.? Okay, so that's selective attention. Those are 2 forms of attention. There are many other forms. But you can see how the structure of music gives us an ideal way to practice those different forms of attention. And you don't have to be a musician to do it. Okay, so we've covered sensory motor, we've covered communication, we've covered cognition. I think we have one more category to cover. Oops. And oh, you know what? I always forget this part. So who benefits from musical attention control training? Many, many different individuals could benefit from strengthening their attention. All right. Definitely, if a person has attention deficit hyperactivity disorder, this is a great technique for them so that they can learn how to focus their attention, not be so easily distracted. Individuals with autism many times have some challenges with attention. Specifically, they have what we might call sticky attention. So they will focus on something, but have difficulty shifting away to something different when they need to do that. And that ability to flexibly shift attention is so important. It's important for learning. It's important for safety. It's important in a conversation, etc. People with mental illness need to enhance their attention skills. For instance, someone who has schizophrenia, a thought disorder, will often have difficulties focusing attention. People with depression, with anxiety, etc., will have difficulty with concentration and attention. Stroke patients many times will have attention challenges. And of course, people who have dementia will have some challenges with attention. So these are just some of the populations that might benefit from attention training. Now we are ready for the socio-emotional domain. So this is our last application here. And you're probably thinking the whole time, well, isn't this what we're going to talk about? Because we love music because of the way it makes us feel. We love music because it's a way that we can connect and interact with other people. So certainly music therapists address socio-emotional functioning. But actually using a music therapy technique for this person for this purpose would be a little challenging to do over a Zoom call. So I'm going to take a different tact here. And I'm going to talk to you about some research that I do in this domain. And I'm going to ask you to help me analyze some data from my research. How does that sound? Okay. One of our, as human beings, one of our important goals in the socio-emotional domain is the ability to self-regulate. Right? Self-regulation is the ability to modify our internal state so we can always be functioning effectively in our environment. So imagine this, you all are in high school right now, and maybe you are on your way to school one day and you have an argument with someone in your family as you're leaving your house, like an argument with your mom or an argument with your dad, and it's really upsetting to you. And your mom's yelling and you're yelling and your heart is racing and you're saying things you really don't mean, and you start sweating. So you're highly aroused, right? You're not regulated, right? You're in a state of high arousal and a lot of emotionality, but you know that by the time you get to school that day, you need to adjust your internal state so that you can focus on what you need to do at school. You don't want to go through your whole school day being all tense about this and upset about this. So you learn to self-regulate. The ability to self-regulate is something that we learn over time, and it depends on this perfect storm, this perfect combination of three components. First of all, we need to be able to focus our attention to help ourselves self-regulate, and that is, you might think of it as being present, right? Not worrying about what happened in the past or what might happen in the future, but just focusing on what is happening right now, getting our attention focused there. We also might need to shift our affect, our emotional state a little bit. Maybe if we're in a negative emotional state, we want to shift it to slightly positive or slightly neutral. Okay, we don't have to be ecstatic, but maybe a little bit more positive. And then sometimes we need to bring down our arousal level, and that would indicate that we have self-regulated. Okay, so what's the connection between self-regulation and music? Let's talk about that. Okay. Um, the ability to self-regulate, to maybe move from a state of high arousal and high distress, involves some key neural structures. Now, we don't have time in our session today to talk about all of those structures, but we're going to focus on some of the main culprits here. Okay, we have anterior cingulate cortex, prefrontal cortex, orbital frontal cortex, and the amygdala. So again, we've got some high-level cortical structures and the very primitive amygdala. Now, let's talk about how each of these might be involved in a situation where we're in a state of high emotionality or high arousal. Uh, if you think back on the situation of like having an argument with someone in your household, the amygdala would initially be activated because the amygdala is the structure of our brain that allows us to experience fear and to experience anger. So it's important for survival, right? And our amygdala may be the structure that says, when I'm angry, I want to become aggressive. But that's probably not going to work maybe in an argument with your mom, right? So then our prefrontal and orbital frontal cortexes would say, based on past experience, being aggressive is not such a good idea, right? And then the anterior cingulate cortex is so important in this process. It really is our superpower as human beings. The anterior cingulate cortex, it allows for communication between our very primitive amygdala and our more sophisticated PFC and OFC. And so that we can feel that emotion or fear of anger, but we don't always have to act on it. Okay? All right. So these are the structures that are active that help us learn how to self-regulate so we're not always ruled by emotion. These same structures, these same four structures that allow us to self-regulate are also very active when we listen to music. How great is that? And so when we're listening to music, especially when we're listening to music with the intention of an emotional outcome, that we want to feel a certain way, or we want to shift our emotion, or we just want to identify the emotion of the piece, when we're listening to music with an emotional intention, these structures are very, very active. Okay, so let's take this to then a clinical application. You might be wondering, okay, as I mentioned earlier, self-regulation, that's a capacity that we have to learn as human beings. We're not born with it. So when do we start learning self-regulation? We start learning it as infants. And we learn it through interaction with very sensitive caregivers who can read our needs and respond. So when an infant cries, the mother knows to feed the infant or change the infant or comfort the infant, etc. Now, as infants, what is the musical stimulus that is heard most often? Would probably be the mother singing. All mothers sing to infants as part of caregiving, and this is known as infant-directed singing. Okay? When mothers sing to infants, they tend to utilize certain distinct acoustic properties in their voices. They tend to sing at a slower tempo. They They tend to sing at a higher pitch level. And especially when they're comforting an infant or trying to get an infant to go to sleep, they might sing with a descending melodic contour. And this is common around the world. And what mothers are really good at is singing in ways that uh, accommodate their infant. So if their infant is being playful, the mother will sing in a playful way. If their infant is distressed, they'll sing in a way that helps the infant to calm down. So mothers intuitively modify their singing to comfort their infant. So I've been looking at this behavior of infant directed singing for many years in my research and looking at, well, how is it that infants respond to their mother's singing and what's really going on here in terms of self regulation? And, infants can't really talk to us about their self regulation, but they show us a lot about their self regulation through their facial expression and through their gaze. Where they're looking, do they look away, how long do they look at a certain stimulus, etc. And my research has shown so far through these behaviors of facial expression and gaze that infants are very much learning how to self-regulate in response to their mother's singing. And I have found this in typically developing healthy infants. I have found these same behaviors in infants born to mothers who are experiencing postpartum depression. And I have found these same behaviors in infants who have Down syndrome. So it's telling me that this is a pretty significant behavior. And this whole interaction of mothers singing to infants is pretty important. Okay, now my current research, just to give you a quick synopsis here, it's funded by the Grammy Foundation, so I'm very proud of that. I like to tell people that I won a Grammy, but it's really just a Grammy grant. And the current population that I'm working with are multi-risk infants. These are infants who are born many times into single-parent homes, low income. There might be situations of drug and alcohol use on the part of the mother or domestic violence in the home. So these are multi-risk infants, and I wanted to see what is happening during infant-directed singing for these infants. So I videotaped these infants while the mothers were singing to them, and I needed a system that would capture the infant response. My previous research, I would typically hire some college students and they would have to watch the videos and they would have to manually code the infant behaviors. It's a very tedious process, takes a long time to get the results. So this time I decided to lean into some AI and I used a supervised machine learning system known as Infant Automated Facial Action Recognition, or Infant AFAR. And this is a system that learns infant facial expressions by detecting movements of specific facial muscles. And when we see certain muscles moving at the same time, it tells us the infant is demonstrating a certain expression, that the infant might be expressing positive emotion or negative emotion or neutral emotion. Okay, so like I said, you're going to help me analyze my data. So let me share with you some of my data. Oh, yes. And the movements of the muscles are called action units, or AUs. Okay, so let's look at some action units here. Okay, so from the research, if we have evidence that shows the infant is demonstrating action unit 12, which is the lip corner puller or the smile, combined with action unit 6, the cheek raiser, this would tell us that the infant is demonstrating a Duchenne smile. And that's a really happy smile. It tells us the infant is not just comfortable, but joyful. Okay. So when we see these peaks in the data right here, and we have another peak here and another peak here, this is showing high levels of action unit 12 and action unit 6 at the same time. So the data look like this, and the data tell me, okay, this infant should be demonstrating a Duchenne smile. So I'm going to show you a picture of the infant, and you tell me if you think the infant is smiling. What do you think? Does that look like a smile? I think so. So I have agreement between my video and my data. Very positive. All right. But we know infants are not always smiling. Infants cry, and they cry a lot. So if an infant is demonstrating action unit 4, meaning they are lowering and wrinkling their eyebrows, and action unit 20, lip stretcher, as well as action unit 6, cheek raiser, this would tell us the infant is demonstrating Duchenne cry face, which is a high state of emotional distress. And the data I collected looked like this for one particular infant. So where we see these high peaks, there's a peak here and a peak here, where we have action unit 4 and 20 and 6 together. This is telling us this infant during these 2 moments in time is demonstrating a high level of distress while their mother is singing. So let's look at the infant face, and you can tell me, does this infant look distressed? Yes. This infant looks distressed. So this tells us we can trust this machine learning, that it is really detecting accurately the movements of the infant's face. And it is telling us this particular infant was having a negative emotional response while the mother was singing. Okay, now let's consider a neutral situation. Okay, so again, if the infant demonstrates action unit 12 with action unit 6, that would mean they're smiling. But this infant didn't really demonstrate any of that. They weren't smiling. They weren't raising their cheeks. Okay, so we might say, okay, did the infant lower his eyebrows? Did they have lip stretcher, cheek raiser? Were they demonstrating distress? No. The data are all minimal. So we would expect this infant to show us a very neutral facial expression. They're not excited. They're not upset. What do you think? Very neutral. So, and again, this is while the mother is singing. And you might wonder, your question, I'm sure the question you're thinking right now is, what's really the best facial expression for an infant while their mother is singing? Do we want them to be excited and joyful? Do we want them to be distressed? Do we want them to be neutral? The answer is probably we want them to be very neutral, right? Because that tells us that the infant is calm, they're in a state of relaxation, they are regulating. Right? So the neutral expression is actually quite good. Okay, so I think we have gone through everything. We went through sensory motor, communication, cognition, and socio-emotional. And those are just some examples of what a music therapist might do. I'm sharing with you now, this is my direct email. So for anyone who has any questions after today, and I'm going to answer some questions now, but if you think of a question tomorrow and you want to email me this. If you have any questions about the Frost School of Music or the University of Miami or the music therapy major, I would be so happy to talk to you about any of that.